Module 4. Do's and Don'ts for passing the NCLEX. The exam contains questions from a few substance classes, making it necessary for graduate nurses to study consistently between the time they register and the date the exam happens. People who want to pass NCLEX RN, they will get the Registered Nurse Certificate. It's a most valuable certification for registered nurse. Do. Take a few practices exam. NCLEX study materials and practice tests are available from Kaplan and other educational publishers, allowing you to get a feel for the test. Take the test numerous times in the months leading up to your exam day for the best results. Solving the practice questions will help you to make your time schedule that how you can answer all the questions. It will increase your capability to answer all questions with confidence. Taking the practice test again a few weeks before your scheduled exam can help you identify areas where you are still weak, allowing you to catch up on complex ideas. Act as if the practice test is the real exam to see how you'll perform. Set aside your study materials, sit in a quiet area and time yourself while you complete the exam items. Don't panic. Because the NCLEX is a high-stakes exam, it's natural to be concerned about how much you know and how well you'll perform. However, worrying about the exam will make it harder to recall what you studied, resulting in a poor performance. If passing the NCLEX is a must for you, strive to have a level head. Before entering the test community, eat a decent breakfast, avoid caffeine, and take a few deep breaths. Because the NCLEX is a high-stakes exam, it's natural to be concerned about how much you know and how well you'll perform. However, worrying about the exam will make it harder to recall what you studied, resulting in a poor performance. If passing the NCLEX is a must for you, try to have a calm head. Before entering the test community, eat a decent breakfast, avoid caffeine, and take a few deep breaths. Do need to study with a group. Group study will give you benefits from the other candidates' preparation. You will get much knowledge attending the group study. For example, in a study published in the Journal of Nursing and Education, Ashley and O'Neill report that in danger, students who joint personnel drove concentrate on improved on the NCLEX than in danger students who were examined all alone. This shows that joining a study group can help you achieve your goal of passing the NCLEX. Don't cram for the test. The NCLEX covers a few substance classes, some more difficult than others, making reliable reviews the ideal way to master the material. However, if you wait for as long as possible to begin reviewing, you're likely to forget important information upon the arrival of the test, making it more outlandish that you'll pass. Besides, cramming doesn't work because your brain tricks you into thinking that you have memorized the material. In reality, your brain is only familiar with the material. When the time comes to step through the examination, you're likely to fail to remember much of what you reviewed during a last-minute cramming session, explains psychologist Tom Stafford. Do understand the NCLEX test plan. The National Council of State Boards of Nursing will help you to give you guideline that when you need to go for exam, if you read this book, then it will also help you to make decision. According to the NCSB, the arrangement includes nursing activity statements, sample test items, solid substance examples, and a summary of the extent of the exam. Reading the test questions and solution will help you to achieve your goal. Don't procrastinate. NCLEX test will valid only for 90 days after completing registration for NCLEX. This implies you should begin studying well before your registration. Otherwise, you may not be ready in time for your test date. The NCLEX is a thorough exam, so a few weeks of intensive concentrate presumably will not be enough to help you pass. Furthermore, first-time test takers had a passing rate underneath 90% in 2019. This addresses the difficulty of the test and the significance of planning when creating your study plan.